if we look at what we've seen in the news regarding coronavirus from the very beginning, and even recently in the news as we look at vaccination rates across the country, we often see a very obvious racial disparity between white Americans and Black Americans. Yeah. And the same is true in maternal health. And so we know that even when you just look at white women, the United States has the worst maternal health outcomes of any developed nation. And those women are more likely to die during childbirth or after giving birth than in any other developed country. What's interesting and even more horrifying is that we spend more money as a country than any of those developed countries. And so it's truly a paradox.
Thank you so very much for taking time and joining me in my luxurious office that I set up just for you and coming into the Rosie Effect.
Thank you for having me, Rosie. I'm happy to be here. Very honored.
Yeah. Let's give the audience a little bit of a background on how we were actually supposed to interview last year and life just happened, different things happened that impacted it. How are you doing and how are things going for you right now?
I'm doing well. I think, like many Americans and people around the globe, I've lost family members in the last year during this COVID era of human history. And so, haven't had the opportunity to grieve collectively the way we normally do in my family's traditions. And I know so many people around the world are experiencing that too. So that's been something that I'm thinking about a lot as I move through my life. But professionally, I've been leading platform growth and strategic partnerships at Mommy, MAHMEE. And Mommy is a really, really incredibly intentional health technology company that focuses on maternal and infant healthcare and really solving some of the root problems that have put women in this country at a disturbingly high risk of dying and sustaining injury during pregnancy, delivery, and during this postpartum period. So I'm very passionate about solving that problem and excited to be at Mommy and so excited to be on the Rosie Effect today. Thank you for having me.
We're going to delve in. This is going to be super duper exciting. I can't wait. All right, let's take a step back and delve a bit more into who Laura is. I know Cornell has done features on you, your passion that intersects in healthcare, tech, equity, and justice. Why do you do what you do? Why did you pursue what you pursued? And you're on this journey. What is it all about?
It's a great question. I grew up in Rochester, New York, and went to school at Cornell like you did. And along the way, I, always thought I would be a doctor and wasn't exposed to this idea of public health until my first year of college at Cornell, when I was taking a class on policy analysis. And we really started to talk about what it looks like to design policies that benefit entire communities of people or regions or countries or global communities. And that was so profoundly interesting to me, to think about how, in addition to being able to treat acute injury and, trauma to the human body and mind, to think about how we could prevent illness in the first place and prevent injury in the first place was really intriguing to me. And so I caught that public health bug early on and decided not to pursue a pre-med track. And I often explain my interests as a Venn diagram with three kind of focus areas. The first being health. And so I have this core interest in health, particularly public health and how we can promote health and prevent injury and illness. And then the second circle is technology and how we can use all of these tools that we've created, our phones and the internet and the tools that we have that can measure our biometrics and predict our health outcomes before we could ever know anything was going to be wrong, which is so neat. But the third kind of bucket and focus area is justice. And that's also something that I had always been exposed to through my upbringing, but also really delved into from an academic perspective as an inequality minor at Cornell, and started to really think about justice and what it looks like to think about health and technology with this lens of equity in mind. And when we look at some of these disparities that we have in the United States and that exist around the world, they're really stark. The disparities are stark, and it's going to take a lot of innovation to change that and to create a world where every human has access to the resources that they need to be well and to be healthy. And so, yeah, I hope that answers your question. That's kind of why why I do what I do.
No, it
I
definitely
guess,
does. Share with me where you see some of the greatest stark gaps, right? When we talk about equality
yeah,
across healthcare and the technology that is abundantly available. You've spoken to about, automated analytics, being able to identify a patient's health journey, being able to create that process. So, what are some of the major gaps you're seeing now, and how is like mommy positioned to solve some of these key challenges that you're seeing?
yes, that's a really great question. So, if we look at what we've seen in the news regarding coronavirus from the very beginning, and even recently in the news as we look at vaccination rates across the country, we often see a very obvious racial disparity between white Americans and Black Americans.
Yeah.
And the same is true in maternal health. And so we know that even when you just look at white women, the United States has the worst maternal health outcomes of any developed nation. And those women are more likely to die during childbirth
Yeah.
or after giving birth than in any other developed country. What's interesting and even more horrifying is that we spend more money as a country than any of those developed countries. And so it's truly a paradox. On top of that, Black women in the United States are 3 to 4 times more likely to experience those life-threatening injuries and ultimately to die in childbirth or during that postpartum period. And so this is one of the most core aspects of human life, giving birth and carrying children and then raising them. And so when we talk about promoting health as a society, that is the one of the disparities that truly that grabs my attention the most.
Mm. Why do you think that's the case? You started, and I appreciate how you looked at the data overall and said, even though the US is spending more in dollars to cater to patients, even looking at it from a white mother's perspective, the number in comparison on a global level is so bad. But then when you look at it from a Black mother's perspective, it's abysmal. Why do you
Oh,
think that is the case?
it I hope that most people can answer that question for themselves now, because it's become a spotlight has been shown on this topic over the last year or so. But I believe that it comes down to structural racism, to policies and structures in society that prevent certain people from accessing these basic resources. Things like housing, things like employment, things like a living wage, and healthcare, right? And access to healthcare that's free from bias and that's free from, trauma, honestly. When we think about the way that particularly Black Americans and also people from Indigenous backgrounds and people from other non-white backgrounds in the United States have been repeatedly mistreated by the healthcare system.
Hmm.
So there's enormous distrust.
The trust, yeah, yeah.
One of the ways that Mommy is working towards really creating technology that parents can trust and also that providers can trust, particularly the providers who are working at the community level. These could be medical doctors, physicians, they could be nurses and nurse practitioners. They could also be allied health professionals like midwives, doulas, lactation consultants, and lactation educators. These are people who are working very closely with women and really thinking about how we build how we continue to support the workforce that is the most in tune with the populations who are most vulnerable and who are most impacted by the disparities that we talked about just now, is key. And making sure that we're engaging those people in the design of technologies and in the design of programs.
Yeah. Wow. So what do you think, based on the areas that interest you, that you go in, you invest in, what change do you think needs to happen in order to start seeing some of these numbers take a real turn?
In the maternal health sector in particular, I think there needs to be a shift of investment, both financial and I think uh, legislative attention towards the solutions that are community based, like I talked about, that are have been tested over the last several decades. These are models that give women wraparound comprehensive support and a smoother continuum of care. So when we talk about digital transformation in 2021 in maternal health, the ideal state, the thing that mommy is trying to get to, is a journey for a new parent who has just become, pregnant, or who's just decided to become a parent,
Yeah.
who has a wraparound resource that is easily accessible from whatever device she's using, her computer, her phone, that gives her access to all of her providers and a library of educational resources that she can read through to become more informed about the decisions that she's going to need to make as she plans for birth. And after she gives birth, she has access to all of the different providers through this technology platform. And so she's never feeling like she doesn't have the support she needs or the information, or that she's trying to reach someone and that person's not calling her back, or that she thinks that something's wrong and that no one is listening to her. Mommy is capturing all of that information and making sure that moms have a voice, and that they're that they are centered in their healthcare.
Wow. I love how you touched on the idea of digital transformation being about the patient, being about the customer, and then taking this customer through her journey and what that sort of journey to care or process of care looks like. And, people might think digital transformation is just about that technology, and that's where they miss the gap in understanding the end consumer in which they serve. And for the most part, that end consumer might not look like them. And then you end up putting out technologies out there that harm. Have you seen any of that news? And what's your take on it? Because I know there was a hospital in New York that was recently under investigation because the AI solution they put out in the marketplace kind of negated their Black patients. And then they're like, oopsies, right? That's the only thing they can do. Who is to blame when this happens? And how can an organization, especially something like Mommy, other organizations that are out there positioned to serve at the core diverse consumers in the wellness and their journey of health, what can be done to actually, on this digital transformation journey, to be positioned to serve in the right way and not end up negating Black patients and people of color and things like that?
Rosie, what a phenomenal question.
You just giving me props just cause?
I'm giving you props all day, but yeah. I mean, that's a really important question to be asking. I think that a lot of companies would move very swiftly in the right direction if they were to pause and have a meeting where their teams were to discuss that question. And it's interesting. The last time that I spoke to you, I was working at Hurdle as the chief strategy officer, and we spoke together about how we had developed language to express the intention behind Hurdle's training, right? And we ended up landing on this concept of cultural intentionality. And I still feel very strongly that that is the approach that ought to be taken when we think about designing technologies or building teams or building companies that are going to, like you said, the global community of leaders needs to be diverse. The people who are leading this work have to have lived experiences that reflect the intimate, details of the problems that we're trying to solve. And if that's not the case, then we will land where, in a situation like you talked about, where there are people in a boardroom designing programs for people who are living completely different lives,
It happens all the time. It happens all the time. I have a friend I was speaking to recently, and she was sharing how an organization, board is all male, all white, and they're building a solution for high diabetes propensity across the population, which tends to be Latinx, Black, you know what I mean? And they're sitting in the boardroom asking these questions. Not one person has taken a step into the community, not one person. So it's like, what exactly are you solving?
And they're profiting off of it at the
Of
end of the
course.
day. Also, and I think that it is possible to have a fruitful discussion about social entrepreneurship and the ways in which we can pursue entrepreneurship and also solve very difficult problems.
Yeah.
However, it can become problematic very quickly when, like you said, people from a certain cultural background come into a space and start to take advantage of and profit off of another group of people who are struggling from a disease state, and that is a result of structural racism and structural inequality in our society.
Yeah, I get so excited because I'm like, I want my community to realize that they are so well positioned to build some of these unicorn healthcare organizations that is changing and impacting their community because they understand the problem at the core. And they might think they might not be equipped or they might not know high tech and what technology solutions, but all you need to understand the problem. And it's just a matter of identifying the right tech solutions. And this is what the Rosie Effect is about, and building a community that brings awareness and bridging the gap when we talk about innovative technology, AI solutions. How do we utilize analytics? How do we, utilize all the opportunities that are there to solve these key problems that many individuals, people of color, being Black, indigenous, being Latinx, you are in communities where at the core you see the fundamental challenges and problems that you're well positioned to solve and build powerful businesses around. Yeah, you got me excited there for a second. Okay, so what influenced you? Let's talk a bit more about Laura and her career journey. What influenced you to shift from huddle to mommy?
So I had been working in the maternal health space for several years before I joined the team at Hurdle, which is, like I said, focused on mental health. Prior to working in these startups, I had worked at the Centers for Disease Control. Back before COVID, before Ebola, back when people intensely trusted the Centers for Disease Control. So,
oh man!
But while I was there, I started to get exposed to more maternal health programming, and I really learned I learned more about breastfeeding, which is often not talked about publicly. There's a lot of stigma around breastfeeding.
Yes.
As an African woman, is so absurd. If you go to so many
why are you even having this conversation?
Right. And so it goes back to this idea, there's probably a deeper discussion to be had at a later date around really why are there all of these issues in maternal health. And it probably also, we talked about racism. We should also be talking about sexism and how there can be, there are these important intersectionalities to be discussed when it comes to healthcare and equity and inequity. And so there certainly are reasons why women's health in particular is far, far behind where it ought to be in terms of the delivery of healthcare. One really simple example of that is just that many medical procedures were, the research that was done to develop those models was just never done on women. So there's a lot of areas of healthcare where, in the same way, a lot of those clinical studies have never been done on Black populations, right?
Yeah, right.
And
great.
So there's an important discussion to be had around that too. But like I said, we'll save that for another conversation.
So it seems like it stemmed from the beginning. You got exposed to it, and then it's like, oh wow, this is really quite a dark hole here. It's a gap that's been kind of not attended to.
Yes, once I understood deeply the inequality and the disparities in women's health, they caught my attention because many of them seem solvable on the surface. So you think, oh, people in health tech often use this example that we can order a car on our phone in 2 minutes and it will show up and pick me up, but I can't do XYZ, right? The problem that they're trying to solve. And it's similar, that I think that for me, once I started to learn about these issues around women's health and particularly maternal health, that women can't safely deliver babies in the United States of America, that seemed like a problem that I had the skills to be able to help impact. And what I've learned is that it's truly a collective effort. There are thousands of women leaders who are working on this problem, and many of them who've dedicated their entire careers, right, decades of work. The co-founder of Mommy, Melissa's mother, Linda Hanna, is an obstetric nurse who worked in hospital and outpatient community settings for 40 years before becoming a co-founder of Mommy. Yeah. So I think I hope that, if you're still hosting the Rosie Effect in 10 years from now and 20 years from now, I don't think this is a problem that will be solved in any short amount of time. It's a very difficult and complex problem. And so I think the reason that I ended up coming back to Mommy after a short stint at Hurdle was that I really feel passionate about this part of health and this part of public health.
Wow. There's something to be said about things that you think are so simple, and there shouldn't be any question or doubt about it. And yet to see that individuals have spent their life investment research into solving these key problems. Wow. Also, P.S. I'm glad you mentioned about the Rosie Effect of being here a decade from today. It's going to be a multi-million-dollar organization, and we might be tapping into maternal health as well. Okay. Whoop whoop. Okay. So it was a wrap when I sat down with you. Okay, so where is Laura's vision for the next 5 to 10 years? What does that look like in regards to what matters to you?
That's a really good question. There's a lot that's unknown. I certainly feel deeply passionate about ensuring that the technologies that I play a role in designing and testing here in the United States get expanded and used widely abroad. And I have always been very passionate. In addition to having a minor in inequality, I have a minor in global health.
Oh, and you just went to Cornell and you said, which bags am I taking today? And you just you went through those campuses like, that's what okay, I respect. Go ahead, sis. Go ahead.
It's like they were like, I'll give you 30 seconds to grab everything you can take. Yeah, I mean, I think that a lot of people who end up at an institution like Cornell feel pressure to check off as many boxes as possible.
Yeah, I know. Motivated though, very, very inspirational. But please go ahead.
Anyway, so yes, I have a passion for global health. I had the privilege of volunteering as a global health volunteer in East Africa. And so have really wonderful connections there, friendships and professional relationships there. So would love to be able to, pilot technologies like Mommy in places like that, where there are even higher maternal mortality rates and even higher infant mortality rates. And so when we think about these challenges globally, the disparities become even more troubling and motivating. So I think, yes, I do think that I'll hopefully be able to broaden the aperture and be, yes.
Yeah, I'm glad you talk about that. I have a friend who's a physician in Ghana, and what you are focused on maternal health, on children's health, is a key area for her as well. And so, hey, you never know, in the future, there could be some collaborations and connections. So, hey, let me ask you about this, because this is kind of a hot topic now. The vaccine for COVID. What is your take on it? And especially since you touched on a sense of trust that has kind of been broken or at least bruised to some perspective, how do you think community's perspective is on the drug, and where do you think that's going? How is that going to change if it's not in the right place?
Yes, it is a hot topic. I mean, I'm glad that you asked about this because it's important to address. So first of all, I think it's important to start by saying that anyone who has any sort of hesitancy or concern around the vaccine is valid in feeling that. And, many of the concerns that people have are rooted in not only historical trauma, but personal trauma around healthcare services, right? So I wanted to start by saying that I think it's important from a lens of controlling the spread of the virus for our population to be vaccinated. Otherwise, we'll face very serious consequences, and hundreds of thousands of people will continue to die from COVID. So I think it's important for people who have had the opportunity to become educated about how vaccines work, particularly people who've become doctors. It's very important that they take time to explain to their patients how vaccines work and why they're safe, and why you need 2 shots and why it takes time for the body to become immune after receiving the vaccine. And it's also important, a lot of people have questions about how this vaccine could have possibly been developed this quickly. And that's a valid question because it is very, very quick, right? That the vaccine has been developed. A new technology was used to develop this vaccine. And there are a lot of physicians and scientists with PhDs who have been, made themselves available to answer questions. So I highly recommend that people who do fall into this category where they have questions or there's hesitancy to do research and to find evidence and facts that will help them to understand some of the factors and the facts that they should consider in making a decision. I'm a big proponent of patients making their own decisions, and making sure that we as a public health community or as a healthcare community are doing our best to provide education and information to make sure that patients can make informed decisions so that they it's important from a public health perspective to make sure that people aren't forced to do things without understanding, the importance of them.
Okay, I'm glad we've touched on the serious topics. Before I get into, because by the way, I'm about to ask you a little personal questions, but before I get into that, in terms of career, we have a lot of women in our community trying to define how they build their careers and take advantage of where they are now. They might be frustrated in the current state. They might be, there's already enough bias in the system of looking for new roles, especially if you're a person of color. What is your advice as you build out your career? You take on new opportunity or you find new opportunity. What are you doing differently, or how are you going about building the Laura brand?
Wow, that's a great question. Very powerful. I think there are a couple of things. The first is that I think that being comfortable and being brave enough to be boldly yourself is key to not only being successful, from a professional perspective, but also just being happy and being well, kind of emotionally and mentally. I meditate every day. I try to go for a walk outside or do some sort of exercise on a daily basis to be well. I take breaks to breathe throughout the day. And I think that there's a sense of presence that exists in my professional life that has been cultivated pretty recently, over the last several years, that I know it has been impactful in my professional life. So that's number one. And I think that kind of all can be combined and put into a bucket of self-care and just wellness. I think that for a lot of professional women, we feel like we're burning the candle at both ends, and that there's a lot of pressure to be a lot of things for a lot of different people, to be a chameleon in a lot of situations. My mommy's co-founder is a biracial woman, and I'm mixed race as well. And so there's a lot of interesting dynamics that, I think that if I didn't take the time to care for my emotions and my mental health on a day-to-day basis, I know that it would affect my work. And so I definitely would encourage, my past self and anyone else who's, going through any times where professionally where they feel like they're struggling or they're trying to figure things out. It's truly a marathon, right? Life is a marathon and our professional lives are marathons. And so I think that self-care is number one. Number two is certainly relationships and being connected, particularly with other women and other women of color, or women from the same background as you. I can't tell you how important it's been to have, women from Black women, but also women from all sorts of different backgrounds come and take part in different discussions, and just hearing the different stories is so inspiring, because it really creates a space to see how similar so many of us are, how similar our stories are, or the problems that we're trying to solve, how interrelated they are. And so I think that staying connected with other people and really maintaining relationships with the people who inspire me the most and the people who are, working to solve the same problems that that I'm interested in solving has been really key to my brand and my growth in the last few years too.
What does Laura do for fun?
Well, okay, I was an athlete growing up, so I love playing sports still. I started playing tennis recently, and that's been really fun. And
were you joining like a group or something? Because I actually was interested in finding a sports group to join.
So I live in an apartment building, and I have a great friend who lived across the hall from me last year. And so we took tennis lessons together, and that's how I learned originally. But I also am pretty musical. I play the guitar and the piano a little bit. So I also like to play music, and I love listening to music. I have a record player, and we like to, I like to have COVID dance parties in my apartment here at home.
The best you can do. Have you been exposed to some Afro beats? Because I might have to get you.
Oh, yeah. So if anyone needs a recommendation for Afrobeats dance classes, I have a great friend from Cornell. His name is Obi, and he's a wonderful dance teacher. So shout out to, I'll send you a link and you can put it in here.
Please do. All right. Before we wrap this up, what would your advice be to a young woman really looking to set foot and change the world, having the vision that they do, knowing that they can impact their community, their surroundings? How do they go about building this idea and making it a reality?
It's a really good question. I mean, I think that there are infinite opportunities to impact the world around you if you remember that the world around you includes the people that you talk to every day, and the streets that you walk on outside of your house, and the local government that creates the laws that you have to abide by. There are a lot of ways that we can engage with our communities, but it does require some time and attention and reflection. And there's a lot that we as humans have to juggle. And so particularly as a young woman, I remember just adjusting to adulthood and trying to figure out where my career was going was stressful. It was difficult. So I think just giving yourself grace is really important. I would certainly give myself that advice. I would be more patient with myself and more patient. I think when you're ambitious, you are in a hurry a lot of times.
Yes. So, it's good. The drive is great and everything, but I'm so glad you mentioned that, because one thing for me this year was to be kinder to myself.
Yes.
And I was like,
weird, because you're so kind to me. Why would I not be kind?
You're hilarious.
You're a kind person. It's interesting because I think I'm a pretty kind person too, but I'm not always kind to myself. So
because you might express that on an external, but because I have this vision and I want to build it, and you keep going. It's like, but be patient and be kind to yourself, right? Because it's gonna work itself out. You're gonna meet amazing people. Hint, hint. A little, throw a little sparkle your way, and they will continue to help and build and make this vision become a reality. So I love how you said kind of like checking in where you just are. Make sure that are you where you believe you're supposed to be, and we know that, we feel that, we're grounded when we're doing sort of our work and things like that, right?
Yes. And I mean, I know you're religious. Yes.
Yes, I am. I love me some Jesus.
Yes, and I'm very spiritually connected too, and I think it's important, if even if you don't have that, that you are taking time to feel connected to some larger purpose outside of yourself, right?
Yes.
Whatever that is. And as long as you're doing that and you're in tune with that, there's a sense of relief and ease that comes with knowing that there's some sort of, there's something beyond you that is going on, right? And I often look to nature as an example of that. When we look at these huge expanses of natural land where nature has just been able to, develop on its own,
Oh, huh.
it's perfect. It's like pristine, right? And
Wow.
it's beautiful. And so I think sometimes we need to remember as humans that we're like that too, that it takes time for us to develop and grow and become all that we want to be and can be. But
Ooh,
sometimes, especially when we're young, especially young, ambitious women, we're in such a hurry and we want to do it. And a lot of us are so open to feedback that we just, we want to go as fast as we can. And that's great. We shouldn't lose that, but we should also be
be
kind to ourselves when we should rest also is, the point.
Wow, wow, this is a great way to end. I love your analogy on nature and just how it populates itself and the beauty behind that when you take, yes, wow. Laura, thank you so very much. This has been an amazing chat. This is just part one of many to come as the brand builds out. And then you owe me taking me out. There's that too. Uh, but aside from that, thank you so much for taking your time and joining me here at the Rosie Effect.
Thanks, Rosie. I'll hope to be back soon.
Woo woo! Bye, Laura.
Bye.